Hello and welcome to another episode of In Good Health with McLaren Macomb. I am your host, Aaliyah Flores, and today we will be sitting down with registered trauma nurse, Jennifer Dixon, who knows how to keep our kids safe this spring and summer. We'll also be checking in on McLaren Macomb's recent efforts in the community with the Walk for Warmth. But first, we're here with surgeon, Dr. Michael Delameda, to learn more about some of the lesser-known benefits of bariatric surgery. And welcome, Dr. Michael Delameda. How are you doing today?
I'm doing great. Thanks for asking.
Good, good. Can you share with us a little bit about your background?
Well, I grew up in California, Southern Cal. I came out here to Michigan for my surgical residency.
Okay.
I've been here since 1990. I went and did a active duty naval tour with the Navy for a while. But since 94, I've been here as a general surgeon here at the hospital.
Okay, and your specialty?
I'm a general surgeon. I have specialties in bariatric surgery, in trauma surgery, and nutritional medicine.
Okay, and in your opinion, is there a misconception or stigma surrounding the people who are candidates for bariatric treatment surgery?
Yeah, unfortunately, a lot of folks still look at bariatric surgery as a very high-risky surgery. In reality, the risk for bariatric surgery, which is a misconception, is no higher than that for a gallbladder surgery or anything else, and that puts it in perspective. That's a very common operation. Risk for complications are low. Other misconceptions are, I don't need it because I'm not that overweight, when in reality, it will benefit folks if they do lose the weight, and we go by something called a BMI. Their BMI is too high.
And what's a BMI?
Body mass index is a ratio to your height and weight. You can look it up online, and it determines whether you're a candidate for bariatric surgery or not.
Okay. And are there certain procedures that are bariatric treatment procedures? Are there 2 or 3 procedures that are out there?
Oh, there
now?
are a lot of them, but a lot of them have proven to be not as effective as others.
Okay.
The 2 most common ones nationally are what we call the sleeve gastrectomy, which is the most rapidly growing one, but the most common one done in America now is the Roux-en-Y gastric bypass.
Okay, and can you share with us a little bit about what that type of procedure is like?
Sure.
Or patients, what conditions do the patients have that would be more susceptible to have that?
It doesn't make a difference, actually.
Okay.
In general, you can apply it to either side. Some folks feel more comfortable with the sleeve gastrectomy because they call it less invasive. A sleeve gastrectomy, they remove around 2/3 of the stomach, and so it's a purely restrictive operation, where the Roux-en-Y gastric bypass, which is by far the best accepted and most successful one of the national centers, has restriction, but also creates what we call a malabsorption piece of your intestine. And most of that is discussed with the patients, so they learn more about that when they come to us.
Okay, okay. So the benefits from the surgery. Can you just explain some of the benefits from the surgery that other people might not necessarily know about? I mean, I know weight loss is definitely a benefit.
So what comes with obesity are a whole host of medical conditions that unfortunately people suffer through and accept because they're overweight. For example, high blood pressure, cardiovascular disease, diabetes, chronic migraines. People, or ladies especially, have stress incontinence where they might cough and sneeze and lose urine.
Okay.
Chronic reflux. And so all these things are associated with the obesity status, and commonly after you have an operation, or if for some reason you're able to lose the weight, almost all these symptoms go away.
Okay.
That's significant.
And how long does it normally take a patient after they have had the bariatric surgery to lose the weight?
You lose a lot of weight initially very quickly, mainly because your caloric intake goes from 5,000 to 6,000 to almost 700 initially because of the stages of diet we pass you through. So you'll find people will lose weight in the first 2 to 3 weeks because they're losing water weight like crazy, and then they start to plateau a little bit and they continue to lose weight. Usually maximal effects are between 12 and 18 months where you really see most of the weight loss.
And what does their diet look like at that point? What are they eating?
I make it very easy for folks. My patients, I tell them avoid white food. And you're saying, what the heck is white food?
Right.
Starch.
Okay.
Bread, pasta, rice, potatoes. Comfort food, it's your enemy.
It sure is.
You want to go, yeah, you're not kidding. You want to go more for the high protein diets, the low sugar diets. If you think about the diets like the low glycemic diet that's very popular right now, it all functions on that. Starch is a sugar. And if you eliminate that, you have a low glycemic diet and you have better control of your diet. And that's a long-term thing too.
Oh, so it's long-term. And speaking of long-term, what is the follow-up like with the patients that have lost the weight? 1 month later, a year later?
We have a governing body here in the state of Michigan that controls actually a lot of our follow-ups. Like we have standards we must follow. We will see you at 1 month, at 2 months, at 3 months, at 6 months, and then every year thereafter for the rest of your life as long as you come to us.
Okay.
So we watch you and we help you and we coach you for the whole process. And by the way, one thing about McLaren Macomb, the surgeon is the one who's in the game. We don't always use other people to manage our patients long run. We take care of our own.
Okay. And what are the psychological benefits for the patient having the bariatric treatment?
Psychologically, patients, when they lose their weight, first have a better self-feeling about themselves.
Mm-hmm.
They're thinner, they become more self-confident. Sometimes you kind of wonder if depression causes them to become obese or if obesity causes them to be depressed. But when you lose the weight, both go away. A lot of times depressionary status improves. Mm-hmm. People have better feeling about themselves. It's a very good feeling on the inside when you've lost hundreds of pounds.
Wow.
They've been struggling with too.
Right. And speaking to that, what type of advice would you give patients or viewers that are watching this right now that are a little reluctant to go in and just even have a consult with a bariatric surgeon?
To do nothing is wrong. Boy, did I say that very plainly?
Yes.
Because the mortality rates go up significantly after the age of 50. If you look, for example, for someone who's overweight, and commonly if you look at your family who's also overweight with you, because a lot of times it's a family issue, you might wonder why your family passed away at such an early age of their 60s. Okay?
Yeah.
So to not do something, you can probably look no further than your ancestors to realize that obesity affected their life. And so to not do something, oh my gosh, you're missing such an opportunity to live a much longer, healthier life for yourself and for your family too.
Wow. Well, we appreciate all of the advice that you've given us today, and thank you for being on the show.
I enjoyed it. Thank you very much.
Thank you.
For more information, visit mclaren.org/Macomb Bariatrics.
And now we're going to go out and hear more about the Walk for Warmth.
McLaren Macomb, through many events, is committed to helping its community.
Again, thank you for joining us for this, the 26th annual Walk for Warmth. And if I can recognize Rhonda Powell, she would like to have a few words. She's with the Macomb Community Action. In fact, she is the director of Macomb Community Action. They are the ones who are really responsible for putting this whole event on, and they've been doing it successfully for 26 years. Congratulations.
Because of your presence here today, we are changing the lives of the individuals who benefit from this event. For every family who is able to share a meal tonight because they were able to purchase food or medicine instead of having to pay a high heating bill, we are changing their lives. We're shining a light on independence and helping them see their way out of poverty. That is the foundation for strong communities.
Today is our 26th annual Walk for Warmth event. Macomb Community Action began this journey in order to make sure that our families in Macomb County don't suffer through cold Michigan winters. The money for this fund, Walk for Warmth, it goes to help families that a lot of our programs are income eligibility based. So often there are families that we may not be able to help if they're slightly over income or if those funds run out. In the event that we, exhaust those funds, then we have this pot of money that we can help individuals that may otherwise have to suffer. Over the years, we've got people who have started with us and are still walking. The run is a new component. So we've only added the run about 3 years ago. But our walkers have been faithful over the years and followed us, and they believe in the cause as well.
Today I brought my kids to the Macomb Mall. We did a Walk for Warmth walk today. It was great. I didn't even know what to expect, but we had a great time walking inside of Macomb Mall. It's been remodeled for this year, and we were happy to be here today.
We're really excited to support a community event like this as a healthcare organization. It's really important for us to keep our community healthy, and supporting a run is a great way to do that. This is the 26th annual Walk for Warmth. It's a great fundraiser to raise funds to help our community members also that aren't able to pay for utility bills, so we're keeping our community healthy and warm.
Macomb Community Action, it has been in Macomb County since 1964. We operate some of those county's largest programs, as Mark Hackle refers to it. We operate the mission side of county government. So in our department, we're really broken up into two divisions. One is where we offer our senior programming. Meals on Wheels is ran through our department, all the chore and HIC services. And then on the community services side, we have our Head Start program. We run Head Start for the entire county. We have about 21 sites around the county. We run weatherization, community development. We have 3 action centers located throughout. We run a SSVF, which is our supportive services for veteran families, where we try to take care of homeless veterans in the county. So we really keep our boots to the ground. Community action is all about, addressing the local need. So. It's a tremendous support, not just the financial support, which we greatly appreciate, but the more awareness we can create about services like this and how we can come together and have resources to give to people when they may approach. You may have someone who comes to the hospital and through emergency, and they may not have the resources or be aware of them. So just the more we can spread the word and collectively take care of our common audiences, I think it's a win for the county.
The Walk for Warmth 2016 raised $24,000.
Hello and welcome, Jennifer Dixon. How are you today?
I'm good. Thank you for having me.
Good. Thank you for being here. Would you just share with us a little bit about your background and your experience?
Sure. I am a registered nurse with a bachelor's degree. I am currently doing injury prevention for our trauma program at McLaren Macomb. Prior to becoming a nurse, I was a social worker for several years worked with sexual assault, domestic violence, and the mentally ill for a long time. But went back to nursing school, and I'm loving what I'm doing now.
Oh, that's always good, too.
Yeah.
With winter now just about being over, and with people getting out more, are there certain injuries that you're seeing more now?
Sure. Actually, they can range anywhere from a broken bone to brain and spinal cord injuries. And we're most concerned about brain and spinal cord injuries because these are permanent. A lot of times with these injuries is people will have permanent disability or they can even cause death. So that's what we're really concerned about, and we're concerned about people drinking and driving. We're concerned about people not wearing helmets while on bicycles and different things like that. So, and also the spring and summertime is a dangerous time for teenagers. It's actually called the 100 most deadliest days for teens.
Really?
Yes.
I was not aware of that.
Yes,
okay.
Because the teens are starting to drink at earlier ages, and they're driving, and they're getting into car crashes.
And they probably think they're invincible as well, and something like that couldn't happen to them.
Exactly.
And it sounds like you're involved in a program. Is it the Think First program that you're involved in, and what is the mission?
Yep. Think First McLaren Macomb is actually a chapter of the Think First National Injury Prevention Foundation. So being a chapter, we follow the mission of Think First, which is to educate and do research and advocacy to prevent brain and spinal cord injuries and actually all other types of traumatic injuries.
Okay, so you give presentations around the county about certain injuries. What is the message that you're trying to impart on during these presentations?
The big message we're looking to impart is, and Think First actually starts with, grades 1 all the way to 12th grade. This program can be used with college students, it can be used with adults, and we're actually, looking at thinking first and driving safely. So that means not drinking alcohol. That means not driving distracted, putting the cell phones down, as well as how important it is to wear a helmet while on a bicycle or a scooter. And how that, the program is not about putting people into a bubble and saying, oh, don't do this or that. That's not what this is about. What it is about is actually to think first before you do an activity. Protect yourself, because brain and spinal cord injuries, they can be prevented.
So Jennifer, what should parents do around this time of the year to help protect their children and keep them safe?
Motor vehicle crashes are actually the leading cause of death between the ages of 14 and 18 years old. I encourage parents to talk to their kids about not drinking alcohol, and certainly not drinking alcohol and driving, to enforce with their kids and come up with a plan that if they are ever in a situation to where somebody has been drinking and wants to drive them home, that they can call somebody else for a safe ride home, to come up with that plan. What is it that they can do? Also talking, to the kids about putting their cell phones down, not texting, not, talking on their cell phones, not driving. Also limiting the amount of passengers in a car, because passengers are very distracting in cars, and there's big reasons why we have some of these crashes.
Okay.
We also like to look at, discussing with people about wearing seatbelts. Seatbelts save lives. It is proven time and again that seatbelts save lives, and wearing them is so important. And for, people to start wearing, and this is not just kids, but this is adults as well, to start wearing helmets on bicycles and scooters. I know a lot of people say, we didn't grow up with helmets and we turned out just fine and what have you. Things are a little different right now. We have more cars on the road. There are more distractions on the road. People are not looking out for pedestrians or people on bicycles. Protect yourself. That's what it's all about. There are simple little things that you can do to protect yourself from a brain or spinal cord injury.
So what are some of those simple little things that we could do to protect ourselves?
Simple as wearing a helmet.
Just the helmet, okay.
Wearing a seatbelt.
Okay.
Not driving distracted or drunk, not diving into shallow water. That we see a lot of injuries that will happen, around the summertime because people dive into shallow water.
Okay.
And those are some of the things that we want. We want to prevent those things from happening. I like to tell parents, to lead by an example. Lead by an example. Don't text and drive. Wear your seatbelt, because the kids learn at a very, very young age. And when they see this and when they get out there and start driving, they start to work in and do these unhealthy, risky behaviors themselves.
And are the parents very receptive to that? Are they listening?
Yes, I think parents are listening.
Okay.
A lot of times, nobody gives us a manual as parents. We don't know. We try to do our best,
right.
and we don't know. We try to follow laws, but sometimes what is safe is the best, and what we could do. So I encourage parents to lead by example and talk to your kids.
And you mentioned pools or water.
Yes.
What are some of the safety concerns that we could help with parents also, as far as their children going into pools, if the parent is in attendance at the pool or not there, and the child has gone off with a family member or a friend?
I recommend that all kids should take some sort of swimming lessons and start at a very young age. Some preventative measures are alarms on the doors, so that kids don't get outside and get into the pool. Obviously having locks, on the pool to, like, maybe the deck, and putting the stairs up so that they can't get in. Watching kids around water. A lot of times people think that when somebody is drowning, they look like they're screaming, they're yelling, they're waving their hands in the air. And when people are drowning, that's not what they look like. It's actually kind of quiet, and they look almost like they're playing in the water. So being aware to that and watching kids in water is very important. And also teaching kids to dive or go into water head first in a safe place, like a pool where it is marked on how many feet. You need at least 9 feet of water in order to dive safely.
Okay.
So
I wasn't aware of that. That's good information.
it is. Lakes and rivers and ponds, these are not good places to dive, not good places to go into water head first, because you don't know what's at the bottom. There could be rocks, there could be logs, who knows?
Right.
And like I tell the kids in the classroom, it could be shipwrecks down there. You don't know.
Right,
You know?
right.
But yeah, it's diving in safe places.
Okay. Well, we certainly appreciate you coming out and sharing this wonderful information with us. Have a great day, and we'll see you soon.
Thank you very much.
Thank you.
Thank you.
For more information, visit mclaren.org/Macomb Spring Safety.
Thank you for watching In Good Health with McLaren Macomb. We'll see you next time.
To view this episode again, visit mclaren.org/MacombBlog.